The Importance and Application of Breast Health for Nursing Practice, created by Carmen Nagar-Newman, Opal Desmarais, Brianna Conkin, and Sarah Jessup. A video made for the purposes of assignment criteria for nursing health and healing, instructor Diane Perry. Why is breast health education important to our practice? We cannot assume a client is educated in breast health or general health for that matter. We are responsible to educate as part of our nursing role. This will include health promotion. The importance of a preventative approach to health has numerous benefits. Our responsibility as nurses. As stated, education is an integral part of nursing practice. Nurses are often in an excellent position to move beyond the client's primary health concern and dig deeper. This incorporates a nurse's role in providing a holistic approach to health. Types of breast exams. There are many types of breast exams that require varying levels of commitment and healthcare involvement. First is the self-breast exam. Like the title says, this breast exam is performed by the client in the comfort of their own home. This exam may be the least intimidating of breast exams as there is no medical intervention. In order to effectively perform this exam, the client must have knowledge of where the breast tissue begins and ends, as well as a methodology of performing the exam. Next is the clinical breast exam. This exam is quite similar in procedure to the self-breast exam, but differs because it is performed by a healthcare professional in a medical setting. The healthcare professional will most likely perform this test as part of an annual physical and may be more thorough than an SBE. A mammogram is a low-dose X-ray of the breast. This is usually done in a medical setting. During this procedure, the breast is compressed into a mammography unit. This test is completed in approximately 15 minutes. The results will be forwarded to the client's physician. A breast ultrasound is a procedure that exposes the breast to high-frequency sound waves to produce pictures of the breast tissue. There is no set requirement for when to receive the breast ultrasound. It is used to determine the nature of the breast abnormality, to supplement breast cancer screenings, and ultrasound-guided breast biopsy. Frequency of breast exams. There are standard guidelines that recommend a specific frequency of breast examination. A self-breast exam is to be done once a month starting at age 20. It is recommended to perform the exam a few days after menses has ended. The clinical breast exam is performed once a year, usually coinciding with a physical. If the client does not go for a yearly physical, an appointment for clinical breast exams can be made. A mammogram is recommended to be performed once every 2 years after the age of 40. Things to look for. When giving a client a list of normal versus abnormal breast signs, it is important to ensure the client knows these lists are varying and someone's normal may be someone else's abnormal, and vice versa. A textbook abnormal symptom may be completely benign for many clients. Teach clients to assess the shape or size of their breast, nipple appearance, discharge, skin appearance, and touch. Abnormal signs may include puckering, dimpling, wrinkling, an abrupt inversion of the nipple, green or bloody discharge, redness, rash, swelling, lumpy, hardness, increased pain, or thickening of the breast tissue. Breast exam instructions. When instructing a client on how to examine their breast, illustrate where exactly their breast tissue begins and ends. Lumps can be missed simply by not examining the breast tissue under the arm or near the collarbone. Indicating where on the breast is most likely to develop a malignancy may assist the client to be thorough in their assessment. How to massage breast. Instruct the client to use the pads of their index, middle, and ring finger. This gives the client the best surface area for detection. Massage in a small circular motion using a nickel as the point of reference. Press firmly. Before your client begins to palpate their breast, instruct them to first examine their breasts in the mirror with their hands at their side, hands on their hips, and hands above the head. Then, lean forward so the breasts are hanging to assess. Then begin breast palpation. Style of breast exam. There are multiple different methods of palpating the entire breast. They all have the same purpose. Two of the most common methods are the tracking method and the circular method. In the tracking method, the breast is massaged from the upper outer corner in a grid-like pattern. The circular method begins with massaging from the upper outer quadrant in a circular fashion, eventually ending at the nipple. Preventative breast health. Although many breast abnormalities may be hereditary, there are some preventative measures that one can take. Nurses can encourage the client to maintain a healthy weight, limit alcohol consumption, exercise, and avoid carcinogen exposure. There have been studies that proved breastfeeding after giving birth can decrease the chances of breast cancer. Remind the client of when they are due for a clinical breast exam, mammogram, and even a reminder to do their home breast exam on a monthly basis.